Depression by Austin Warner and Ryan Yeatman.
About depression. There are several types of depression. Major depression is where you have severe symptoms that interfere with your body to do basic tasks like work, sleep, study, eat, and overall enjoy life. And usually you only have several episodes of this, so it's more concentrated and extreme in a short period of time. Then there's pretty much the opposite, which is persistent depressive disorder, in which you feel depressed for about 2 years at least. A person is diagnosed with this disorder may have episodes of major depression along with periods of less severe symptoms. So it is longer, but it's not as concentrated and extreme in a short amount of time. Psychotic depression occurs when a person has severe depression plus a form of psychosis. So you sort of hallucinate and have disturbing false beliefs, you'll be confused, you sort of break away from reality, and basically like that. Postpartum depression is what women experience after giving birth. It's a mixture of hormonal and physical changes and just the mindset of having new responsibility like that of a newborn child sort of overwhelming you. And this is somewhat constant. It happens in about 10 to 15% of women, and around birth. Bipolar disorder, also known as manic depressive illness, is not as common as major depression or persistent depressive disorder, and it's characterized by cycling mood changes and hitting extreme highs and extreme lows, and sort of having uncontrolled outlashes.
Symptoms: persistent sad, anxious, or empty feelings, feelings of hopelessness or pessimism, feeling of guilt, worthlessness, or helplessness, irritability, restlessness, loss of interest in activities or hobbies, fatigue and loss of energy, difficulty concentrating, remembering details, and making decisions, insomnia and early morning wakefulness, or overeating and loss of appetite, thoughts of suicide and suicide attempts, aches, pains, headaches, cramps, or digestive problems that do not ease even with treatments.
There are many types of treatments you can go for, but many people use a combination of treatments, such as medical and psychotherapeutic. For depression that doesn't respond to these treatments, non-drug approaches can always be effective, either alone or used with other treatments. Many types of therapies are, or at least the main ones, are cognitive behavior therapy, where a therapist will examine your behavior and attitude and patterns in it and try to take out the unhealthy patterns. Interpersonal therapy, where it focuses on your relationships with other people and trying to resolve those issues and see how they affect you. Problem-solving therapy, where it focuses on how you find solutions to problems and tries to help you become better at that. And then medicines are also available, such as selective serotonin uptake inhibitors, other serotonergic antidepressants, serotonin and norepinephrine uptake inhibitors, tricyclic antidepressants, and monoamine oxidase inhibitors.
Which of the following is not a form of depression? Major depression, physical depression, psychotic depression, persistent depressive disorder. Give you a little more time to answer it.
Alright, if you picked B as your answer, you are correct. We did discuss major depression, psychotic depression, and persistent depressive disorder on the About Depression page. Physical depression is not correct. Depression in the U.S. To the right, there is a chart sort of showing the age groups in the U.S. where depression happens and the percentage. So refer to that as we go along. Major depression is one of the most common mental disorders in the United States. In 2012, there was an estimated 16 million adults aged 18 or older that had at least one major depressive episode in the last year. This represented about 6.9% of all U.S. adults. Also, 2.2 million adolescents aged 12 to 17 in the U.S. had at least one major depressive episode in the last year. This represented 9% of the U.S. populated age 12 to 17. Although this is a big problem in the U.S., there's a lot being done to try and help it. A total of 22.8 billion was spent on treatment for depression in 2009. So they're hoping through the use of extra funds being put into helping fix this issue that we can resolve it and making it not the most common mental disorder.
Depression in England. The number of suicides in England has fallen over the past 10 years, but with a small rise in 2007. The suicide rate is higher for some groups, including young and middle-aged men, people in care of mental health services, and prisoners. England wants public services to reflect the importance of mental health in their planning, putting it on par with physical health. They are making better access to mental health services and shorter waiting times. They are providing £400 million between 2011 and 2015 to give people more access to psychological therapies, including adults with depression and children and young people.
If you didn't catch that, on the right there is a chart showing the ratio of adults receiving antidepressants and sort of where and how much it's going on. So that is there. Depression in Africa. More than 5% of people in the Middle East, North Africa, Eastern Europe, Sub-Saharan Africa, and Caribbean have depression. The burden is highest in Afghanistan and the Middle East and North African countries. In the case of North Africa/Middle East, conflict in the region increased the prevalence of depression, leading to a higher burden. The global burden of depression disorders have increased over the years due to longer life expectancy and population growth, especially in developing countries where increased life expectancy due to reproductive health, nutrition, and the control of childhood infectious diseases means more of the population are living to an age where depressive disorders are prevalent. The prevalence of depression was significantly higher among females than males. The prevalence was also higher among those with a low level of education. Over 90% of respondents with depression reported global role impairment. Mental disorders are a major contributor to the burden of disease in all regions of the world. Was 14% of the global burden being attributed to neuropsychiatric disorders. Even in Sub-Saharan Africa, a region with the highest burden of communicable disease, neuropsychological disorders account for nearly 10% of the total burden. Mental disorders are not only linked to many other health conditions, but are also among the most costly medical disorders in terms of projected health care expenditures needed to treat them.
Comparison. South Africa has lower rates of depression than the U.S., but this could be untrue as the number of clinics is much greater in the U.S. than South Africa, so there is a less chance of third world depression being reported. Depression has been dropped slightly as more money is being put into helping against it in countries like England and the United States, but with conflicts and diseases in third world countries like South Africa, things don't appear to be getting better for them.
And the map below shows, using the colors, the red is more extreme and the more blue is less extreme in the prevalence of diagnosed clinical depression. So refer to that as well. The only thing about it, though, too, is it makes third world countries look less depressed, although they have less clinics, so it is really hard to treat it or to see that it needs to be treated. Why do you think depression varies based on the development of a country? That is the discussion question we are going to end with. So think about that. Thank you for listening. This is our bibliography. We have sources from MIMH.gov, government policies, mental health services, an article, sadag.org.
Yeah, thank you.